Thank you. So I want to tell you about our cost of living work and its impact on people in Hertfordshire. We launched this report last year at our AGM, so it's really, really nice to be able to come back and have the opportunity this year to tell you about the impact of the work. And also I just wanted to mention that we were really honoured this year to receive a commendation for this piece of work at the National Healthwatch England Impact Awards. And I know that partners who are involved in this work have also put forward this for some other awards, including HSJ awards and national awards, because it is a really, really good example where you can actually see tangible impact. So going back to when this piece of work started just over a year ago, we knew that the cost of living crisis was a national issue, and it was in the headlines on a daily basis. And we also then started to receive an increase in signposting cases and intelligence from a range of partner organisations about the impact of the crisis locally in Hertfordshire. And so this clearly highlighted to us that we needed to get a clear picture of the impact on Hertfordshire residents, particularly on their health and well-being. And we knew that we needed to engage directly with residents to find out their lived experience. So as a result, one of our core aims was to gain that county-wide picture of the impact. So it was really quite a broad piece of work, and hearing from residents about what issues were affecting them. And we wanted to collect demographic data from residents so that we could identify groups that were potentially being disproportionately impacted by the crisis. So we were hoping to get a good response rate, but when we heard from over 7,000 residents, it completely surpassed our expectations. And it's something we're really proud of. Within this 7,000, also a large number were from typically underrepresented groups. And another key aim was for us was to focus on people's lived experience and personal stories. So nationally and locally, as is often the case, research can focus on collecting quantitative data, but for us it was really important to hear those detailed accounts of how people's mental health, physical health and access to healthcare had been affected. Thousands of people shared long, detailed paragraphs with us about the extent to which the crisis had impacted them and their families. And that showed us how much people wanted to share their experiences and their stories. And, you know, clearly people took a lot of courage for people to open up about a topic like this and about the difficulties in their life and how hard their life had become. Our main purpose was to share findings with all providers across Hertfordshire, including the NHS, voluntary community, faith and social enterprise sector, county council and district councils, to evidence the change that was needed and to enable them to improve and target support where it's most needed. And right from the beginning, we had immense support from all of those partners because they were as keen as us to find out what they could do to support people in Hertfordshire. Next slide, please. So given that we heard from over 7,000 residents, we collected a lot of data which highlighted what changes were needed in the county. So I've chosen a selection of statistics that kind of pull out the reality of the struggles people were facing. So overall, 9 in 10 Hertfordshire residents have been impacted by the cost of living crisis. 45% said their access to healthcare had been affected, including collecting prescriptions, attending services, going to the dentist or opticians and buying medical devices. 55% said that their mental health had been negatively affected, with many experiencing low mood, stress and having difficulty sleeping. And 32% said their physical health had been negatively impacted, with many people reported skipping meals, not being able to exercise or living in cold and damp conditions. And only 12% had access support for their physical and or mental health. So we found that some groups were disproportionately affected, including ethnically diverse communities, people aged under 54, single parents, carers and disabled people. So as you can see from the quotes on the slide, our findings showed that urgent change was needed and that we needed all providers across the system to understand the desperate reality that many residents were really facing so that they could increase and target support, which is something that all those partners were keen to do as well. So, you know, you can see from those quotes how powerful it is to hear in people's own voices. Next slide, please. So how did we achieve change? We played a central role in the county-wide cost of living response group, which was set up by the County Council. The response group consists of a wide range of providers from across the system, including NHS, voluntary community faith and social enterprise sector, local government, and others who used our data from this piece of research to target support where it was needed. But given the widespread and concerning nature of the impact on people's lives as we started to gather that evidence, and the high number of responses that we were receiving, which was really, in a completely different scale to other pieces of work that we've done, we identified an urgency to improve support. So rather than waiting till our final report, which would have been several months later, we shared the data with the cost of living response group on a bi-weekly basis so that they could hear that real-time feedback and start to act on it and make changes immediately. Also, for the same reasons, with this piece of work, we produced an interim report halfway through, sort of roughly halfway through the project in January 2023. Then we'd already heard 4,000 residents at that point. So again, the findings from that interim report were able to be implemented sooner to try and help support residents. So I can tell you a few examples of where our work has had impact. In response to our data, our local mental health trust, HPFT, partnered with the County Council's Money Advice Unit so that people whose mental health is being impacted by money problems and concerns related to the cost of living crisis would be able to receive money advice immediately alongside the mental health support that they were already accessing. And to date, that has resulted in 377 referrals, resulting in people being able to access over £600,000 of benefits that they were entitled to, and also the distribution of one-off payments and benefits accounting to over £100,000. So it's quite rare that we've got this sort of tangible impact where you can actually see in figures how people have been supported. To show the real impact on people's lives, can tell you a little bit about Paul's story. It's not his real name, but this is someone who accessed this service. So Paul's situation before, he was under the care of mental health services, receiving treatment and support for depression and stress. He was homeless and he only had somewhere to stay for one night at a time. He was underweight and he suffered from gastrointestinal issues. He struggled and often failed to be able to collect his medication from the pharmacist, largely because he was preoccupied finding somewhere to stay every night. And the DWP saw Paul as fit for work, but he missed appointments at the job centre because the notifications went to his email account on his mobile and he had no charge or credit, so he couldn't access that. And then this led to his benefits being stopped. So in terms of the project being able to support and support Paul, the first assistance that the Money Advice Unit advisor organised was an £80 supermarket voucher for food, so that Paul could use his benefits then to pay his phone bill. But unfortunately, it was too late. A second benefit sanction was applied to him. So then the advisor helped Paul to challenge the sanction and get medical evidence to show he was unfit for work. Meanwhile, the DWP were chased up to make a hardship payment, and a food bank voucher, hygiene products, and help with his application for housing were all provided to Paul. A month after the advisor had challenged that first sanction, the DWP overturned both sanctions and reimbursed Paul £690 in unpaid universal credit that he was entitled to. This meant that he was able to pay off his overdue phone bill, so then he could access everything on his phone, and then he knew when his job centre appointments were and was able to access them. With his income restored and stable, he then had the option of paying for a bed in a hostel each night, so he didn't have that wasn't his concern every single day, and he knew where he was able to stay. And that freed up time for him to collect his prescriptions and eat more healthily to help his condition, and also make efforts then to find more stable long-term accommodation. Beyond that, the Money Advice Unit then continued to work with Paul, but that's just the start. You can see that in one person, how that's impacted one person's story. In addition, on a sort of separate element where we've been able to have an impact, our data from this cost of living work was also used to develop the council's Building Life Chances programme. which supports disadvantaged communities in addressing issues such as food insecurity and health inequalities. Our data was used to identify a range of organisations supporting people who are most likely to be disproportionately impacted by the cost of living crisis, provide funding to them. As of autumn 2023, so it's a little while ago now, but a total of £82,000 have been provided to a wide range of community organisations from the Building Life Chances Fund. A couple of examples of groups that benefited from this funding are Hearts Welcomes Refugees in their Bikes for Asylum Seekers scheme, Angel Support Group, who provide a programme supporting neurodivergent parents, and Women of Grace, who raise awareness and provide support for survivors of female genital mutilation. Excuse me. They're just a couple of examples of how our work has led to impact, which has then improved things for people in Hertfordshire. The County Council has also used our data to look at how it can increase awareness and uptake of service provisions, such as warm spaces and helplines, and for initiatives providing support to those facing fuel poverty. The NHS has also been proactive in using our data to improve support for patients and staff. For patients, the NHS has created warm spaces, trained staff on how to signpost patients with financial concerns, and set up cost of living web pages. And for staff, local trusts have provided food bank vouchers, free fruit and tea and coffee, free parking in some places, and subsidised stores in hospitals. So yes, I hope that gives you an idea of the impact of that cost of living work, and to answer any questions.
Thanks, Ken. I'll let you manage your own questions. We just had some very useful audience feedback that sometimes for people sitting in the back of the room, it's hard to hear the questions. So when you ask a question, if you're able to, would you mind standing up when you do it? So it makes it easier for people to hear.
Kevin Minier, my question is, did we learn anything from those people that what they found, how they helped themselves, how they supported themselves, those people that maybe didn't get into that category, or they were dealing with the crisis in their own way? Did we learn any sort of techniques that they used?
I don't think that is something that we have actually really picked up on, because all our research was focused on what are people experiencing, and the struggles they're having. But I think, there possibly are a few examples where people did give that information, but that wasn't really what our questions were focused on. But it's a really interesting point, and it's a good point. I think it's something that will be worth us going back and looking at, what we found out, or what people told us, and seeing whether there are some, some points to pick out from that. I'm not sure whether our questions would have elicited that information, but I think we should go back and have a look, because I think it's a really good idea.
Because it also might highlight our communication channels that really worked.
Yeah, I think that's, I'll take that one back, because I think that's a really good point. Thank you.
Building on that, Claire, about you and some of the patient engagement for Kevin. So 7,000 people have shared what they feel, maybe anonymously. We know 330 have taken action. Building on Kevin, wouldn't it be wonderful if we could find a way to encourage a bigger proportion, whether it's through Herts County Council, to just come forward and ask for help? That seems to be a big issue for people. They're scared to ask for help because it might end up on a GP record or a work record, and it's how do we integrate wise, really encourage people just to feel brave. I think that there's such an opportunity.
I think that's a really good point, and I think that's something we'll continue working with partners to do what we can to sort of spread the message or share information, because it's essential. Thank you. Yes.
Calling the Government Chief Nurse West Fast. In our ED department, this is an amazing piece of work. I would love to see something like this program in our front door. So across our patch, we're currently seeing a lot of poverty, patients coming in that actually all of this would really support them. And I just wondered what are the next steps and how do I get this at my front door to try and support the patients?
Yeah, I think you're right. I think from our point of view, we do the research and we've got those findings which are there, which we're happy to share widely and support in any way we can as well. Comms wise, if there are messages we can share. you know, for us, you know, it's kind of, that's kind of, you know, we can't do the doing of providing that, but we will support it in any way we can. So if there are individual organisations that want to kind of, you know, have a look at the report and then find out more, ask us questions, there's ways we can support bringing through patient voice as well. We, you know, yeah, we're glad if you can use this information in your organisation.
What actually happened last year, we had a conversation immediately after the report. One of your wonderful colleagues, Joe, somebody who's moved on now, did a brilliant 2-pager that all we did was get it out what we could, but we never thought about nursing. You know, so wouldn't it be brilliant to see them take that 2-page and do something like that?
Is your thought that there could be a sort of bring and buy sale type thing in any for people to report into if they have financial issues or property issues or whatever? Is that what's going through your mind?
I mean, I guess there is a high percentage of patients who come to an ED department because they're crying out for help. And it's not necessarily that they have a medical need, but it's somewhere safe, it's warm. And I think that there is so much more we can do to try and help those patients, which will help us for the ED department, but also help the community. So whatever, I don't know, I don't have the answers to what it should be, but actually anything that anyone can do to kind of come to it.
Can I just bring in Christy, because she's really central to that work at the county council, so I think she'll be able to help.
So my name's Christy Packer. I work for the Hertfordshire County Council, and I've been heading up the cost of living response, which has been a multi-agency group, and obviously we have a brilliant data from Healthwatch informing that. Now we have a cost of living response. So we have a variety of ways for residents or citizens of to access services. And I feel quite sad that you don't know about that we haven't managed to reach nursing teams to let you know the range of cost of living support that's out there and that you can access. And the one thing I would say to you is if you have anybody coming in, is just to let them know about Heart Health. So Heart Health is 7 days a week, it's a telephone number, and it will make sure it signposts them to the support. At the moment, in Hertfordshire, we do have funding for the Household Support Fund. This is government funding, and this finishes at the end of September, but what it has meant is that if people need to access food vouchers, energy vouchers, they can access it through what's called the Welfare Assistance Scheme. So all of that information is on our cost of living web pages on the Hertfordshire County Council website. And we did actually produce flashcards for the professionals, so they don't have to remember anything, they can just have these flashcards. So what I'll do is if anybody needs any of that information, I'm just trying to think if I send my email address or if people want to contact me directly, I can make sure that we can get those flashcards out to you and that information out to you, because there is a lot of support out there. And yeah, so I just really want to make sure that people know about it and that access it. So obviously there doesn't seem to think there's a information block.
Back to that communication problem.